So, yeah. Uh, Hi all, I'm Dr. Bhargavi Venkatesulu. So today we'll be recalling NEET MDS 2025 questions on the subject of periodontics. Okay. So before moving on to the question paper, as we analyzed, they were straightforward image-based questions, like with they were very straightforward, like with no further delay, we can just give the option and go for the next question. But there are also some certain methodological question where you have to apply the principles we read and then answer the questions, and there were also little confusing terms, right? Okay, so we'll see in detail about the each question in the upcoming slides. Okay, so yeah. So the first question is, identify the theory of child psychology that includes the concept given in the image, right? So from this image, it's very clear that this question, no one can go wrong. It's very straightforward. So the image you can see here, it has two theories. One is the iceberg concept, and wherein the tip of the iceberg is above the sea level. And underneath we have preconscious and unconscious mind. Also, we have one more thing is topographic model, right? Which includes your three psychic triads, that is your ID, ego, and superego. Yeah, so this image is very clear cut that we can go for the answer. It is Sigmund Freud's psychosexual theory. Okay, so just to brush up the theory. So what he did was he basically compared human mind to an iceberg, right? Where the conscious mind, which is tip of the iceberg, this one is your conscious mind, where the tip of the iceberg is the mental activity at present. Like we know, these are the things that we know about the person. Where the underneath your preconscious and your unconscious mind. So your preconscious is they have the stored memory and knowledge. Like they are aware of it, but at present they don't want to get into that. So those are your preconscious mind. So like meaning these are your memories or your stored knowledges. All right. So next is your unconscious mind. Your unconscious mind is like they're unaware of, like things we are unaware and we are not aware of. Like so, this includes all your fears, unacceptable desires, violent motives, irrational wishes, immoral urges, selfish needs, shameful experiences, and traumatic experiences. All right. So, not only this, he also gave what do we say, three psychic triads, right? So what are those psychic triads? So before going on to the definition, I'll just give an basic things like what is your ID, ego, and superego. Okay, so just I'll just give you an example. Imagine a child is passing by a pastry shop with his or her parents at night time. So he's just seeing a piece of cake, and now he wants to have the piece of cake. Now what he'll do, he'll just start throwing tantrums. He'll cry, he'll hit himself, he'll do whatever he want. At the end of the day, he want to eat that piece of cake. So that is your ID. So basically these three are stages of personality development. Okay, so that particular personality is your ID. Okay, now imagine he's going and politely asking his parents whether he can have that piece of cake, right? So now the parents are telling, yeah, okay, you can have the piece of cake, but thing is you have to go back home and brush your teeth. So in this way the child's desire is also getting fulfilled with understanding of certain social morals, right? So next is your superego. So herein the person he himself consoles that, so seeing a piece of cake, it is an unwanted piece of junk, so it is better to avoid that. So that is your superego. So this is basically stages of your personality development. Okay, so to just brush up about other theories, you have Erickson's stage of development, where he gave 8 stages of development, through which a person just goes through 8 stages of development from his infancy to old age, through 8 stages of life, each of which he'll develop basic virtue. Like in first year, he'll develop hope. In 1 to 3 years, that is in stage two, he'll develop will, and it goes on till the eighth stage. At the eighth stage, he'll develop wisdom. So the basic virtues will be a hope, will, purpose, competence, fidelity, love, care, and wisdom. So each are developed at each stages of life. And next is your Piaget's cognitive development. So Erickson gave 8 stages, where Piaget gave just 4 stages. He just gave 4 stages that in each stage the person evolves himself. Okay. So now, so all these are your psychosocial and psychodynamic theories, okay, which includes both your psychosexual and your psychosocial. You can see here is even Pavlov conditioning theory. So this is different from these three, that this is your behavioral theory, okay, like where you just learn through a behavior, okay, you are learning through some behavior. So example, you all know the dog at the bell concept, like where in the image you can see the dog conditioning. You can see the dog, as soon as he sees the food, is salivating, okay. And in the second image you can see the bell is rang, but he's not salivating, because thing is there is no food, he's not conditioned, okay. So during conditioning, as soon as the bell is rang, he's getting his food, right? So after seeing the food, he's just salivating. This is during conditioning. So after conditioning, as soon as the bell is rang, he's starting salivating, thinking that he might get his food in a few minutes. So this is what your Pavlov conditioning. So this, when it applies to the child, yeah, when a child enters your clinic for the first time, he's gonna come, he's gonna answer all your questions, he's gonna open his mouth, help you, and that just show his mouth to diagnose everything you do. You do and caries removal, room and spoon excavator. Yeah, until then it is going to be good. As soon as you start the aerator, the child is going to jump out of anxiety and fear. Yeah, right. So now you're sending him back, and you're doing the treatment, you're sending him back, you're asking him to come back after a month or two. Okay, just imagine. Now, as soon as he comes back to the second time, as soon as he sees you in a white coat, he's gonna cry. So this is your condition. The child has been conditioned. Like the doctor in white coat is going to treat us with an aorta, which is going to increase the anxious. He has been conditioned already. So this is basic points to answer the questions on child's behavior. I mean, child psychology. So going on to the next question. Okay. So moving on to the next question. Okay. So yeah, moving on to the second question, where we have a patient of age 5 years old has his primary second molar missing bilaterally. Which space maintainer would be indicated in this case? So, as far as space maintainers are concerned, it is always important to double or triple check the child's age, okay? Because rather than deciding what space maintainer to give, it is best to decide at what age, what space maintainer to give, so that they play their role only when it is given in the particular time. So the child's age is 5. Now you have to have in mind, whenever the space maintainers are concerned, you should have the eruption sequence in mind, also the child's age in mind. Now if the patient is 5 years, meaning there is no clinically evident permanent teeth is present in the child's mouth, right? So because he's 5 years. Now, what space maintainer would be given? So at 5 years, the child is not going to have any permanent molars. Okay, the eruption time for permanent molar is going to be 6 to 7 years. So in that case, your band and loop is rejected, meaning both your bilateral and reverse band and loop are rejected, because as you can see in this image, where the bands are bonded to your permanent molars, right? This is your bilateral band and loop, and this is your reverse band and loop. In see, in both the case, you're going to bond the bands to the molar, permanent molar. In see, in both the cases, you can see where the second molar is partially, I mean, it is removed, either it is extracted or it has been shedded. See, here you can see the primary first molar, okay, and you have your permanent first molar here. At the center, in both the images, you have your primary second molar missing, right? So here you can see the thing is, you have the permanent molar. See, the band is bonded to your permanent molar. See here in this image, you can see reverse band and loop, right? This is also a clinical case of reverse band and loop, where they have given the reverse band and loop, but here you have a permanent, like erupting molar. At least your permanent molar is erupting here. So they have given the reverse band and loop. So in such cases, your band and loop is eliminated. So you can go for simple removable acrylic space maintainer. Yeah. Now moving on to the third question. A patient of age 4.5 years reports to the clinic with the chief complaint of discolored tooth in the upper front region. What is the best treatment plan? So here you can see the keywords are going to be your, again, child's age, discolored teeth. So discolored tooth is meaning your non-vital tooth. The teeth is already non-vital. Patient age is 4.5 years. Okay. So the patient is not patient age is 4.5 years. No, now is it okay to go for extraction, because it is just in primary teeth? Okay, so can we go, most often the question asked is, can we go for extraction? No, extraction is not, it should not be done. It is basically avoided because it can cause any speech difficulties. So the first option, I mean the last option, extraction, is eliminated. Now, since the tooth is non-vital, right? It has been given the discolored tooth. So what are the other, like you have to go check for non-vital pulp therapies, right? Your indirect pulp capping is your vital pulp therapy. Your pulpectomy is your non-vital pulp therapy. Again, your pulpotomy is your direct, like it is your vital pulp therapy. So the only option that is non-vital here is your pulpectomy. So to discuss here, we have indirect pulp capping, direct pulp capping, apexogenesis, pulpotomy. So these are your vital pulp therapy, meaning only the coronal pulp has got damaged. Your radicular pulp is still in condition. So you can do all these vital pulp therapies. Whereas your non-vital pulp therapies, there are two. One is your pulpectomy and next is your apexification. Your pulpectomy is your, like the RCT in permanent teeth is your pulpectomy in your primary dentition, right? Apexification. Here, the main difference between your pulpectomy and apexification is done in your young permanent teeth, okay? Not in permanent teeth, in your young permanent teeth. So I'll discuss in later slides about that. And extraction, as I said, extraction is avoided to prevent the speech difficulties. Now, fourth question. Yeah. In a patient with age 7 years, primary second molar is extracted. Okay. Again, regarding the space maintainer. So what I told, if the question is regarding space maintainer, all you have to have in your mind is double check your child's age. So child age is 7 years, right? So the child will have primary permanent, permanent molar in his mouth. Okay, now what we have to do? Space to be maintained till premolar erupts or space to be maintained till canine erupts. No need of space maintainer. Reduce space to accommodate the premolar. So you can see in this image. So imagine this is your permanent first molar. It has been erupted in the oral cavity. Now, this is your second molar. Primary second molar. Okay. So this second molar is missing now. Okay. Now imagine this is your primary first molar. Okay. What we have to do, this is removed, right? This is extracted. Now, do we have to maintain the space? Yeah, obviously we have to maintain the space till this premolar, because the succedaneous tooth here is your permanent second premolar, which is underlined beneath this primary second molar. So you have to maintain the space till the space to be maintained till premolar erupts. Does space need to be maintained till canine erupts? No, not needed. Not needed, because your canine is going to be your succeediner of your primary canine. Okay. So we can just maintain the space till unless and until your premolar erupts. Now, to the fifth question, identify the age of patient with the image given. So yeah, as you can see here, you can see the image. Okay. So from it is very straightforward again through the image where you can see only the primary teeth is present inside the oral cavity. All right. Where your permanent molars are yet to erupt. So it is, the child is going to be definitely less than 6 to 7 years, right? So then you can go for 5 years. Now, next question. Non-vital permanent maxillary central incisor tooth with open apex and large periapical radiolucency along with adjacent mesiodens. So, what will be the treatment? Okay. Now, see, your non-vital, again, if you can see the part here, the thing is non-vital. Non-vital meaning it is what? Discolored tooth. Meaning the only option you have to go when there is non-vital, meaning it is your root canal, that is your endodontic therapy, right? So it has been given that non-vital permanent maxillary central incisor tooth with an open apex and large periapical radiolucency along with adjacent mesiodens. So what will be the treatment? So the like I can say the trick word here is like it is an like what do we say? It is include for your answer. Like open apex and large periapical radiolucency. Your open apex, teeth with open apex, or your what? Or called as your blunderbuss canals. All right. So your non-vital permanent teeth, meaning you can tell since it is permanent teeth, yeah, we can go for RCT. Many of you will go will just tick for RCT, right? Because it is in permanent teeth. If it is in primary, you can go for pulpotomy. Okay, so we can go for RCT. You can just tell. But thing is, permanent teeth. But one more word they have given is it has open apex. All right. So in such cases, you should go for apexification. All right. I'll tell in detail about the apexification next slide. So your RCT is done for permanent teeth, but I'll tell why RCT is not done. I mean, RCT is before RCT, we have to do the apexification. I'll tell you that. And pulpotomy. Pulpotomy is basically a primary tooth, so we are just rejecting that. So now apexification. So as the name you can see, apex is meaning root apex. Fication is to make or to create. We manually create a calcification barrier. Fication is meaning we are manually creating. Genesis meaning genesis is basically biological process like your oogenesis, spermatogenesis, embryogenesis, ontogenesis. All these are your naturally inducing process. Okay. Whereas fication is something we're going to create. We're manually going to create like magnification, apexification. Okay. So this is the basic difference between your fication and genesis. So where this apexification is done. So as you can see in this image, the both are your permanent teeth, right? Here you can see like an apex, a closed apex, right? So here you can see open apex, like you can see a narrow walls, but here you have most divergent and parallel walls than and narrow walls, right? So this is because the teeth is just erupting. Imagine the child would have been age of 6 to 7 years, so that though the crown is clinically visible in the oral cavity, it almost takes 2 to 3 years for the entire root to get formed. So at the age of 9 or 10, the root is going to get completely formed. But unless and until we just can't wait for the treatment option to do, okay? Because the child will have discolored tooth. So it is necessary to do the treatment now. So yeah, it is an endodontic treatment. Now what we have to do is, since there is no any apical stop here, you have to create an apical stop. So that is your apexification. After the apical stop is formed, you can go for normal obturation and post-endodontic treatment. Okay. So most commonly your calcium hydroxide and MTAs are used. So calcium hydroxide is multi-step procedure wherein you have to call the patient in between once in 3 months to check for the apical stop formation. like at the apex formation, after which you can go for obturation. But whereas in MTA, the apical stop is formed in between less than or more 48 hours, and then you can go for the obturation. So you can also check for blunderbuss canal. So these blunderbuss canals are your non-vital young permanent teeth with incompletely formed roots, or called as your blunderbuss canals. So next question is, a 1 day old child is brought to OPD with a tooth-like structure. What should be the line of treatment? So there are certain questions where you have to, where even after n number of revisions, we end up confusing certain terms, right? So one such term is natal and neonatal tooth. Okay. So your natal tooth. Hmm. Okay. So, your natal tooth is nothing. Just remember like this. Your natal, neonatal. Okay. Neonatal is something like newly formed teeth, which is not present at birth, or it is newly formed. Okay. Like formed after 30 days of birth. You can just keep it in mind like that. Like after birth, newly formed teeth are your neonatal. Teeth which is present at birth, or your natal teeth. So here you can see 1 day old child, meaning the teeth is present from birth. So the answer is natal tooth. Okay. And the option is natal tooth, no treatment. Natal tooth, it generally requires no treatment if it is not creating any big issue. So yeah, the option here is natal tooth. Natal tooth, no treatment if not creating any issue. So natal tooth, they generally, the patients, like the child will have difficulty in feeding, even the mother will have difficulty in breastfeeding. Sometimes riga fide disease are seen. Like those are the lesions which, because of which the baby will have certain lesions or some lesions in the gingiva. So in such cases, we can go for extraction. And unless and until if it is not getting any issues, there is no treatment needed. So this is again in one confusing statement. While treating a child with caries, the dentist switched from aerator to spoon excavator. This is an example of. Okay, so to speak here about the child here, so we have to see that the dentist is switching from aerator to spoon excavator, right? And like he or she is not just quitting the treatment, they are just adding again something, like they are removing the aerator and they're not sending the child back home, right? They are just using spoon excavator. Okay, so like they're just adding something. So this is an example of positive reinforcement. There are they are telling like it is in sort of negative reinforcement because the dentist is removing the erotor. Like, so why is it in positive reinforcement? Because it is replaced with spoon excavator. Okay, so imagine now while treating a child with caries, the dentist asks the child's mother to move out of the clinical room, or he just asks the mother to wait outside the lobby. Now the stimuli, that is the child's mother, is removed from that room, right? So that is, you can name it as negative reinforcement. Okay, now imagine if the question is like this, like while treating a child with caries, the dentist switches from spoon excavator to aerator. Like if it is upside down, spoon excavator to aerator means the child has been exposed through stages of treatment, like first spoon excavator, and then little by little aerator, and then they're going through the pulpectomy, and then the forced endodontic treatment, like from low level treatment to a higher level treatment. So that is your desensitization. Okay. So this image is to tell clearly that be it positive or negative reinforcement, at the end of the day, both are going to increase the child's desired behavior. Okay. The positive and negative depends upon the either you're going to add the stimuli or you're going to remove the stimuli. Okay. Like you can also say you can give some stickers, or you can give them their favorite cartoon characters and all, which increases a child's behavior. So those are your positive reinforcement. Negative is like if you ask some of their parents, generally childs do not respond well when the parents are inside. That to pampered child. Okay, in such case, when you ask the parents to move out of the room, they're going to increase child's behavior. So that is your negative reinforcement. Now, again, this is a straightforward question. Antibiotics contraindicated in children. So whenever you have tetracycline in the option, yeah, that is most contraindicated in children. The only, I would say, the first line of drug which is contraindicated children is tetracycline. And again, this is the basic mechanism, like how tetracycline causes the discoloration. It basically binds with the calcium molecules which is present in your teeth, and it produces the discoloration of the teeth. But one thing, this not only seen in teeth, it is also seen in bone and nails, where it get deposited in the where it gets binds with the calcium and deposits in the external surface. So this is your these are some of the lesions which we get confused when we see the images. Like fluorosis, you will have a clear-cut demarcation between the where you have the clear-cut demarcation between the affected, and that is your affected and your not affected. And then this is your Turner's hypoplasia. So Turner's hypoplasia is a separate entity where it can be because of any damage to your primary teeth. It goes and affects your permanent teeth when it is getting calcified, when it is getting during its formation stages. So the last question here is, a 3-year-old child has a DMFT score of 4. So what type of caries will you classify the condition as? So now 3 years old child, you can say it can be your nursing bottle caries or your early childhood caries, not because of not your rampant caries, right? Because rampant caries is also seen in your permanent teeth. At 3 years, child is not going to have any permanent teeth. So at 3 years, it is very you can give it as nursing bottle caries or your ECC. Here, you can see the DMFT score as 4. Okay. So when this is actually a tip, like whenever you see the DMFT score in the question and you can see the ECC in the option, you can just go for ECC. But thing is, you have to check for the moderate or severe. Okay. So for that, you have to know about the DMFT score in ECC. So if the DMFT score is 1 to 3, you can give it as mild. Basically, ECC has mild, moderate, and severe type depending upon the DMFT score, right? Like, so the DMFT is 1 to 3, can go for mild. If it is 4 to 6, you can go for moderate. Severe in case of DMFT 7 or higher. And you can see the DMFT score here was 4. So you can tell it is in moderate ECC. No, but there is one other criteria describing severe early childhood caries, where if the DMFT score is greater than or equal to 4 at the age of 3, greater than or equal to 5 at the age of 4, greater than or equal to 6 at the age of 5. So increasing the DMFT one by one, and the age increases, decreases. So you can just remember it like that. Age 3 plus 1, 4 is a DMFT score. Age 4 plus 1, 5 is a DMFT score. Age 6, I mean, age 5, 4 after 5, age 5 plus 1, 6 is a DMFT scores. In such cases, you can give it as severe early childhood caries. So here you can see it is severe ECC because child's age is 3 and the DMFT score is 4. You can give it as severe early childhood caries. So as you can see here, the basic comparison between your nursing bottle caries and your rampant caries. So actually you see early childhood, your nursing bottle caries is also a type of your early childhood caries. Okay. But the main difference is in nursing bottle caries, your mandible incisors are not affected because of the like nursing pattern. So basically a nursing bottle caries is because of your prolonged breastfeeding whenever the child asks and at at even at night time during when the child sleeps. Okay, so in such cases, you can give it as nursing bottle caries. Okay, so here ECC is given, and the basic ECC is also a type of nursing bottle caries, right? So okay, the basic difference between nursing and rampant is your rampant caries. It is seen both in primary and permanent teeth, whereas your nursing bottle is seen only in your primary teeth. Even your ECC is seen only in your primary teeth. Okay, that is the most basic difference between your rampant, nursing, and your ECC. Okay. So your rampant is widespread, like at very in a small amount of time. Widespread of caries lesions will be involved in case of rampant caries, even if permanent teeth is or involved. Okay, whereas a nursing bottle caries, specific. This is in only the specific teeth, like your as I said, not your mandibular incisors are affected because actually the etiology is because of breastfeeding or prolonged like giving sugary fruits, liquid sugary foods like your milk, juice, or pacifiers with dipped in honey. All these can cause GK. Okay. So with this, I conclude. Thank you.